In a country where safe and regulated distribution of drugs remains a challenge, the Anambra State government, led by Professor Soludo CFR, has responded with an innovative initiative, the Oba Pharmaceutical Hub, a project situated at the over axis of the Onitsha-Owerri Expressway. Welcome to Solution Footprints. In today's episode, we'll tell the story of Oba Pharmaceutical Hub, a project being constructed by Governor Soludo's administration. My name is Chidimma Oranwa. Stay with us. In the heart of Anambra State, the town of Oba is undergoing a transformation unlike any before. Spearheaded by Governor Soludo CFR, the construction of a state-of-the-art pharmaceutical hub promises to redefine the Southeast-South region's economic landscape and enhance the health and wellness of its citizens. Anambra has long struggled with a disorganized and chaotic system for drug distribution and marketing. This has resulted in a proliferation of counterfeit, substandard and adulterated medication circulating in the region. Unfortunately, these harmful products often find their way into the homes of Anambra and other Nigerians, leading to significant financial losses and health consequences. The administration of Professor Soludo is committed to changing the situation for good. By taking decisive action, the Anambra State Pharmaceutical Distribution Hub in Oba was established, thereby breaking the 24-year-old jinx. This initiative aims to transform the sale and distribution of pharmaceuticals in Anambra into a secure, organized and professional operation that adheres to global best practices seen in other parts of the world.
A project that Mr. Governor said that must come to light. And if you know Mr. Governor, once he sets his eyes on the ball, there are no excuses. He must only deliver. This project you're looking at here have been in the incubator since 2001. That's 24 years. That is when the first time the idea that, let's relocate the open drug market at Obogu to a more conducive place. And it is in that line that the then governor of blessed memory, Mbadmiju, acquired this massive piece of land for structured relocation of both pharmaceuticals and allied practices, and also other sections of the market. But since then, the pharmaceutical section have not been able to take off because of a lot of hiccups I may not want to go into right now. But I will summarize that when Professor Soludo, the loving governor of Anambra State, came in, he immediately identified that one of the core businesses his citizens and his brothers have control is pharmaceuticals. So we cannot control such array of pharmaceutical chain distribution, and the practice will be in a non-professional and unlicensed place like where our brothers are now. So he started with the engagement. He called our people. Do you want a better place? They said yes. Do you want to practice professionally? They said yes. Will you be ready to abide by the rules in line? They said we have been praying for that. He said in Anambra, consider it done. And you are right now standing on the biggest pharmaceutical distribution hub in West Africa. that is going to stand on 50 hectares of pharmaceutical distribution outlets.
The establishment of this pharmaceutical hub is not just about creating jobs. It's about ensuring access to affordable medicines, fostering innovation in healthcare solutions, and positioning Anambra as a leader in the pharmaceutical industry. It is a project of the Anambra State Government in collaboration with the Federal Ministry of Health, National Agency for Food and Drug Administration and Control (NAFDAC), Pharmaceutical Council of Nigeria (PCN), Central Pharmaceuticals and Allied Products (CPA), Pharmaceutical Society of Nigeria (PSN), and Obogu Market Union Headbridge Onitsha. The Anambra Coordinated Pharmaceutical Wholesale Distribution Center is an expansive initiative covering 50 hectares along the Onitsha-Owerri Expressway. When completed, key features include an accessible self-sustaining ecosystem designed to facilitate efficient, seamless, and organized drug distribution channels and activities, administrative buildings accommodating NAFDAC, PCN, and other relevant regulatory agencies, enhanced convenience for patrons to register with NAFDAC and directly import their products due to the availability of retail space, a robust infrastructure featuring a solid road network, independent power supply with a sustainable green energy option, and reliable water supply and treatment facilities, along with banks and recreational amenities, all complemented by ample parking space.
You walk into that gate, the first building you are seeing, you saw there is NAFDAC building. The second one you are seeing is Pharmaceutical Council of Nigerian building. That means drug cannot cross that gate without these regulatory agencies saying it's qualified to even come here. Which means you cannot even practice here. You must now conform to the NAFDAC criteria. It is impossible for fake drugs to walk in here. I say impossible. So you are seeing a model pharmaceutical drug distribution center here. What is happening here? There will never be a time again that NAFDAC will come and close any shop. Once this kicks off at the speed Mr. Governor have put it now.
The space will also feature convenient accessibility to and from neighboring southeastern and southern states. In fact, the Oba Distribution Hub stands out for its unique design and adherence to international standards. The facility is meticulously segmented and organized through a professional site layout for various categories of medicines and drug products. But what does this mean for the people of Oba and the greater Anambra community? Engineer Anthony Uzo Ejiofor is the President General of Oba Community.
Our people are very overwhelmed, especially the fast and the rate the job is going on. We can't, it's almost a lot of this is going to attract to Oba. Some of our markets, other markets will spring up. There has been some other big markets that have not started operation many years back. So with this pharmaceutical hub, all of them will take off. And these are majorly owned by Oba people. So you can imagine how we feel to have investments that will take up in due course, especially in the administration of Professor Charles Soludo, 4+4. Soludo, 8 years. Oba people of recent, you notice some moving from one party to ABGA party in solidarity to Professor Charles Soludo. Oba people anonymously has said that this time we are going to stand behind the governor, the solution governor.
This market will open up Oba. This market will add to the population we have, thereby bringing revenue to the community, to the local government, and to the state. Estates are built and our balance will improve. So thank you, the governor, for making this possible. We use this medium to ask our people, the Oba people living at home and abroad, to come and key into this project. The pharmaceutical hub is actually the second biggest project the governor has embarked on this first time he is in office, apart from the government house, the lighthouse. This project is big, is large, and we are privileged as an indigenous of Oba to be host of that market. So thank you so much, Mr. Governor, for making this. The solution you pledged has come to Oba.
Currently, many residents travel long distances to access medications and healthcare services, which in most cases are administered in unhealthy conditions. The pharmaceutical hub will change this reality by not only increasing the availability of essential drugs, but by also reducing costs. Upon completion, all drug wholesale centers in Anambra will be closed down and relocated to Oba. One may ask, why the relocation?
I've been in this market for about 8 years. I've been one of the members of the committee that was formed earlier about that very project, CWC. So that CWC is the best thing that will happen to us. So CWC is a very welcome development, and it is the best thing that can happen to us. We have been expecting it because this place, PCN and NAFDAC have said that this place is no longer safe for this kind of business, and we can attest to it. We are pleading with the governor to please fasten the process. We have stayed long, so it's a good development. We are welcoming it, and the governor has made a promise unto us. We are eagerly waiting for the fulfillment of that promise. So if it can come today, tomorrow, we will be very happy about it. Truly, this place is no longer good. The market, the business has expanded so much that we need to get a better place.
We like the expansion for the fact that we are relocating. We hope to stay in a place that will be more ventilated, according to what NAFDAC told us when they came for the sanitization that they came for. We were not really thought about take this one is good. Okay, now they are telling us about window and all that. No, we don't have prior information about those things. So, but if we go to that place now and we have all those things, we will start afresh.
The project that started as an effort to sanitize the unwholesome practices in the open drug market is now emerging as the largest coordinated wholesome center, first of its kind in West Africa. The story continues. The federal government of Nigeria has to date approved 3 wholesale distribution centers for pharmaceuticals in Nigeria, including Kano to serve the northern region, Lagos to serve the western Nigeria, and Anambra to serve the southeast and surrounding south states.
Our company is basically handling the infrastructures around these facilities. That includes the drainage work, the erosion controls, and some part of the buildings. We've come this far. As you can see around us here, we've done over 1.5 kilometers of road, stone-based. We've done over 5,000 meters of drainage, different sizes, 750 by 750, 1 meter by 1 meter. And we are also presently engaging on the discharge drain to the stream. So, and our building too is also equally going on, and work is going on simultaneously on all this area I just touched. Work is equally going on the erosion control to be able to make sure that we don't have erosion threat on the road facility. Generally, we have about 7.3 kilometer roads, and we've done clearing for almost all the roads, while we are concentrating on this area that we are developing. So as the building moves, the road infrastructure and the drain infrastructure will also move with the building. There is work going on 24/7, and the project is well funded. We are working 24/7, no stories, no problem. We are not having problem from the communities. We are not having problem from the outside invaders, which are the criminals. We are having serious issues in security, and contractors are coming in and going out, no harassment whatsoever, and work is going on speedily. So I must give kudos to His Excellency. He has done so well. I am so happy and so proud of Anambra State. I'm equally so proud to be an Anambarian. I'm very proud.
This will not only change the narrative from a chaotic drug distribution in a gridlock arena to a serene, systematic and organized location, but also safeguard the health of Anambra and Nigerians and sanitize the drug distribution system in Anambra State.
If any Nebasa drug is under the exclusive list for Nigeria, it's a federal affair. So federal government is 100% in charge. From here, I'll be going to Aba on inspection. For those who will be going to the wholesale system, because we want to make sure that the drug market, the leadership that we maintain in the drug market, that we continue to maintain our leadership in that particular sector. But we are going to build and have the most modern drug market, that open drug market that we are going to have anywhere in Africa. And that is going to happen. This is going to happen in the next several months. Probably by this time next year, we will call on you to come and say, so that this kind of thing will not happen again. We're not going to be coming every few years to come and close up this place. So there will be proper checks. The drugs that come into the market are properly certified, and that no drug, substandard or adulterated drugs can make it into our markets again. Because we want the whole world to be coming to Onitsha to shop. The whole world must come to Onitsha to shop.
Ultimately, it has a high return of investment on the real estate through owning a shop, premises or suite.
We'll be happy if the project finish as soon as, and we will happily and quietly moving into that place. This place was built in 1974. And maybe when this place was built, we have not grown so enormous like today. And the challenge is that every day our number is increasing. To get shop here is not an easy something this time. We are settling our servants on daily basis, monthly basis, yearly basis. So here is no longer much conducive for us. And we're also thanking the state government for their intervention over this project. Because for past 10 years, this project was approved to us. It was very difficult for us to manage and handle until this government came in and take it upon themselves. I so much believe in this government because they know what to do and how to do it. Have done a lot of things what we have never seen in this Anambra State. Some people is calling him Oluwatoegu, but myself I call him Omerifenirola, because what he did in Anambra State we have never seen such before.
The hub is poised to address critical healthcare challenges, especially in rural areas.
The new energy being brought into it now by government, because the project became kind of comatose somehow. But with the new energy, I think that our people are happy, because at the end of the day, we are the people who are going to have the first feel of whatever that will come out of it. Improved development, employment, both in the business area and the springing of houses, and because our rents will go up now. Yes, rents will go up, and the medicine people or the medical people will be closer to us. That will improve our health too, and that will also bring us closer to the government, because we will now begin to appreciate the government more than we did before in the past, and know that the government is not a magic house. We are working to support him to make sure that he goes back there and continue what he's doing now, because we want that project to be completed, and we want to believe that there will be an inflow of development which will spread to other places, so that we all get the dividends of the democracy.
The impact of the hub extends beyond healthcare. Thousands of jobs are expected to be created after construction, more so now. The project will provide training programs in pharmaceutical, manufacturing, research and development, and quality control.
Why you are seeing the speed at which this work is going. You are here actively less than 1 year, but you can see for yourself how far Ojoru Emogo, Owatu, Shalewamba is putting in to put a smile on the faces of not just Nigerians, but so that our people can do their business with pride, that they can do their business in controlled environment. When you say, I'm selling in the coordinator, people will say, you are a lifesaver.
It will also be very, very important to thank the Honorable Commissioner for Health of Anambra State, who have been in the trenches for more than 3 years. We cannot thank Mr. Governor enough for this landmark project.
As the hub takes shape, local businesses are already feeling the positive impact. Increased economic activity brings more consumers and fosters a vibrant marketplace in Oba.
As you can see, we are very happy. Our people are very happy. The youth are also very happy, because with the emergence of this market, definitely is going to reduce youth restiveness in Oba. A lot of youth are going to find a job there. A lot of youth are going to be engaged in that market. So I would say that youth are people who are most happy about the market being located in Oba. We are 100% ready. The youth are a very good instrument when it comes to security. At the end of the day, with the help of Soludo, the governor of Anambra State, the solution governor, he made it possible.
The construction of the pharmaceutical hub symbolizes a brighter future for the Anambra. With better health access, job opportunities, and economic growth, citizens are filled with hope and optimism.
In their own wisdom, decided that this business, being a highly regulated product, should be relocated to a more conducive place. It is a welcome development. It's a good idea. And we that are dealers, farmer dealers, we are compliant. We agree with that arrangement. And we are working towards that. Last time we had issues with NAFDAC. It is because of the chaotic situations that we have here that led to all those things.
The right thing must be done. We've been here. Shops are very costly, scarce, and we do settle our boys on a yearly basis. So we need expansion. The project will afford us the opportunity for everyone to have his or her own shop. So having discomfort is not an issue here. We must move there. That will be comfortable for us. It will also assist our business, because here is too compacted.
The pharmaceutical hub is not merely a construction project. It is a promise for a healthier, more prosperous future for the citizens of Anambra. As the work is being straightened out, so too is the groundwork for a community empowered by progress, courtesy of the hard-working, jinx-breaking governor, Chukwuma Charles Soludo. With Governor Soludo leading the way, join us in following this journey as we witness the transformation of Oba and Anambra into a beacon of health and opportunity.
This is Owogo Market, a place where drug trade is taking place in Anambra State. And they are so excited with the development of Oba Pharmaceutical Hub. Now, when this particular project is completed, it will serve as a solution to regulate the indiscriminate distribution of drugs in Anambra State. And that's it for this edition of Solution Footprints. Join us next week for another refreshing episode of Solution Footprints. Do well to follow us on our social media handles at Solution Footprints on Facebook, Instagram, TikTok, and YouTube, and Solution FP on X, formerly Twitter. My name is Chidemma Orawa. Indeed, Levi, Solution is here.